Hello everyone, welcome to my channel Prana Bisara. So today we will be studying Pakshaghata. Contents, reference, introduction, nirukti, synonyms, nidana, purvarupa, rupa, samprapti, types, sadhya asadhyata, upadrava, modern correlation, research update. Reference, Charaka has mentioned in his Chikitsa Sthana, 28th chapter, Vatavyadi Chikitsa. Sushruta has mentioned in his Nidana Sthana, first chapter, Vatavyadi Nidana. In Ashtanga Hridaya Nidhanasthana, 15th chapter, Vatavyadi Nidana. Madhava Nidana, 22nd chapter, Vatavyadi Nidana. Introduction. Pakshaghata is one among 80 Vataja Nanatmaja Vyadi, considered as Maha Vatavyadi. Here, aggravated Vata dosha gets localized in Sira and Snayu. Then it affects Asti, Majjavaha, Srotas and also affects the functions of Karmendriya, Gnanendriya and Manas. Nirukti. Pakshasya deha angasya gatam vinashanam yasmat yatra va. Pakshaghata is the condition in which one side of the body is affected, showing weakness or injury or loss or destruction of its parts. Synonyms: Ardhanga Shosha, Ardhanga Gata, Pakshavada, Ekanga Roga, Ekanga Vata, Pakshaghata, Ardhanga Vata. All these synonyms are because of half paralyzing of the body. Nidana. According to Acharya Charaka, as mentioned in his Chikitsasthana, all the etiological factors mentioned for Vatavyadi. Aharaja Nidana, Ruksha, Shita, Alpa, Lagu Anna Sevana, Viharaja Nidana, Ati Vyayama, Rajagara, Vegasandarana, Manasika Nidana, Chinta, Shoka, Krodha, Abhigataja, Marmagata. Atyushni, Ati Swinni, Ati Vidde, Agnanair, Visravitam, Ati Pravartate. Tad ati pravrittam shiro abhitapam andyam adimanta timira pradurbhavam dhatu kshayam akshepam daham pakshagatam ekanga vikaram. Ignorant physician perform bloodletting therapy in too hot season and after excessive sedation therapy. As a result, blood flows out excessively, resulting in the manifestation of Pakshaghata. Purvarupa. Avyaktam lakshanam tesham purvarupam iti smritam. Milder symptoms can be considered as purvarupa. Samprapti and lakshana. Adogamaha sa tiryag damanir urdhva dehaga yada prakupito atyartam matarishva prapadyate tada anyataram pakshasya sandibandhan vimokshayan hanti paksham tamahurhi pakshagatam vishagvaraha yasya kritsna शरीरम अर्धकर्मण्यम अचेतनम ततः पतत्य सुन वा अपि त्यजेत अनिल पीडितः. When aggravated vata moves downwards, sidewards, upwards in the channels, it affects one side of the body. It loosens the bonds of the joints and afflicts that side. The best physician called this condition as Pakshaghata. When half of the entire body becomes inactive and devoid of a sensation, the person afflicted by Vata either falls or even loses their life. Atmaikam marataha paksham dakshinam vamameva va kuryat acheshtam nivrittam hi rujam vakstambameva cha grihitva ardam sharirasya sirasnayur vishoshya cha padam sankochayatyekam hastam va todashulakrit ekanga rogam tam vidyat sarvanga sarvadehajam. Vata affecting one half of the body, either right or left, it causes cessation of movement, pain and also speech impairment. Vata affects the one half of the body by drying up Sira and Snayu. It causes contraction of one leg or one hand, producing pain. If the disease affects one limb, it is called as Ekanga Roga. If it affects whole body, it is called as Sarvanga Roga. Grihitva ardam तनोर्वायुः शिरस्नायुर्विशोष्य च पक्षम अन्यंतरम हन्ति संधिबन्धान् विमोक्षयन् कृत्स्नो अर्ध कायस्तस्य स्याद् अकर्मणो विचेतनः एकांगरोगं तं केचिद् अन्ये पक्षवदं विदुः सर्वांगरोगस्तद्वच सर्वकायाश्रिते अनिले. Vata seized a part of body and dries up Sira and Snayu. It destroys one side of the body, releasing joints and ligaments. His entire body becomes inactive and devoid of sensation. Some call this condition as Ekanga Roga, also known as Pakshavada. Similarly, Sarvanga Roga occurs when Vayu pervades entire body. It leads to generalized paralysis. Samprapti Nidana Sevana, Vata Prakopa, aggravated Vata gets localized in Sira and Snayu, causes dryness of Sira and Snayu and looseness in joints, leads to paralysis on either side of the body, either Vama or Dakshina, and that leads to Pakshaghata. Summary: Charaka has mentioned symptoms like Chesta Anivritti, Ruja, Vakstamba, Pada Sankocha, Toda Shularat. Sushruta has mentioned symptoms like Akarmanya Achetana, Patatyasun Marana. Whereas the symptoms mentioned in Madhavanidana and Ashtangaridaya are Akarmanya Achetana. Samprapti. As per Acharya Charaka, aggravated Vata dries up Sira and Snayu and affects either right or left side of the body. As per Acharya Sushruta, Vata traverses Adoga, Tiryak and Urdhva It does Sandibandha Vishoshya. As per Madhavanidana and Ashtanga Hridaya text, aggravated Vata dries up Sira and Snayu and affects either right or left side of the body. There are no types mentioned in Sushruta Samhita, whereas in Charaka Samhita, Madhavanidana and Ashtanga Hridaya, Ekanga Roga, Sarvanga Roga are mentioned as types of Pakshaghata. Pakshaghata is broadly classified into two types based on the dosha predominance: Shuddhavatika Pakshaghata, Pittanubandhi Pakshaghata, Kafanubandhi Pakshaghata. Body part involvement: Ekanga Vata, Ardhanga Vata, Sarvanga Vata, Adharanga Vata. Dosha Pradhanyata: Daha Santapa Murchaha, Syurvayu Pitta Samanvite, Shaitya Shota Gurutvani, Tasmin Neva Kafanvite. If Pakshaghata manifests due to association with Pitta, it causes burning sensation, increased body temperature and fainting. If Pakshaghata manifests due to association with Kapha, it causes coldness, swelling. Depending upon the body parts involved, Ekanga Vata, in this state only hand or leg gets affected. Ardhanga Vata, in this state one side of the body is affected. Sarvanga Vata, in this state both arms and legs gets paralyzed. Adharanga Vata, in this state lower extremities of the body are affected. Sadhya Asadhyata: Shuddha Vata Hatam Paksham, Krichra Sadhyatama Viduhu, Sadhyam Anyena Samsrustam Asadhyam, Kshaya Hetukam. If the Pakshaghata caused due to Shuddha Vata, it is Kashta Sadhya. If it is caused in combination, that is Vata plus Pitta or Vata plus Kapha, it is Sadhya. And it is caused due to Vata plus Dhatu Kshaya, then it is Asadhya. Garbhini Sutika Bala Vruddha Kshineshu Asruksrute Pakshaghātam Pariharet Vedana Rahito Yadi. Pakshaghata may manifest in pregnant women, women after delivery, old people, emaciated persons, and that caused by heavy bleeding and loss of sensation in the affected limbs should be refused for treatment. Upadrava, Murcha, Kshina Mamsa, Daha, Mrityu. Modern correlation. It is correlated to paralysis. The complete or partial loss of voluntary muscle function resulting from damage to nervous system is called as paralysis. Types based on the lesion site: spastic due to lesions of upper motor neuron, flaccid due to lesions of the lower motor neuron. Based on the body part involved: monoplegia, paralysis of single limb; hemiplegia, paralysis of one side of the body; paraplegia, paralysis of both lower limbs; quadriplegia, paralysis of all four limbs and maybe trunk. Here is the correlation. Ekanga Vata is correlated to monoplegia, Ardhanga Vata is correlated to hemiplegia, Sarvanga Vata is correlated to quadriplegia, Adharanga Vata is correlated to paraplegia. Clinical features: loss of voluntary movement, muscle tone change. If it is stiff or tight, it causes spastic paralysis. If it is loose or floppy, it causes flaccid paralysis. Muscle wasting, difficulty in speech, loss of function of bowel and bladder. Causes: vascular causes, Interruption of blood flow to the brain, it leads to neuronal death. Its types include thrombosis. Here the clot forms in the cerebral artery and which leads to ischemia. Embolism, clot travels from the heart and leads to sudden blockage. Hemorrhage, rupture of a cerebral vessel and it compresses the brain tissue. And all this leads to hemiplegia. Next cause is infection. CNS infection causes inflammation and a neuronal damage which leads to flaccid or spastic paralysis. Neoplastic, brain or spinal cord tumors compress or destroy neural pathways which leads to hemiplegia or paraplegia depending on location. Spinal cord diseases impair spinal cord function which leads to paraplegia. Cerebrovascular diseases. Cerebrovascular diseases are the conditions in which blood supply to the brain is affected either due to blockage or rupture of blood vessel. Stroke syndrome is the cardinal feature of cerebrovascular disease. Stroke. It is a neurological disorder caused by either blockage, that is ischemic stroke, or rupture, hemorrhagic stroke of the blood vessels in the brain, leading to sudden loss of neurological function such as paralysis, speech difficulty, or vision problem. It is of two types. Ischemic hemorrhagic stroke. In ischemic, obstruction within a blood vessel supplying blood to the brain. Whereas in hemorrhagic stroke, when a weakened blood vessel ruptures. Transient ischemic attack. It is often called as mini stroke. It is caused by a temporary clot. Clinical features of stroke. If you suspect a stroke, be fast. Loss of balance, blurred vision, asymmetrical face, difficulty in raising arms, slurred speech, then immediately call 911. Risk factors: high blood pressure, smoking, diabetes, high blood cholesterol levels, heavy drinking, lack of regular exercises, obesity, etc. Investigation: CT scan, computed tomography quickly detects bleeding or blockage in the brain. MRI, magnetic resonance imaging, provides detailed images of brain tissue to find early signs of stroke. Carotid ultrasound checks for narrowing or blockage in the neck arteries. Blood test assess factors like blood sugar, cholesterol, and clotting. Electrocardiogram detects heart rhythm problems that may cause stroke. Spinal cord injury. C4-C6 injury causes tetraplegia. T6L1 injury causes paraplegia. Investigation: neurological examination, imaging studies, electromyography, spinal tap, blood test. Neurological examination assess muscle strength, reflexes, sensation, and coordination to localize the neurological deficit. Imaging studies, CT scan detects brain or spinal cord abnormalities like bleeding, tumors. MRI provides detailed images of brain and spinal cord lesions, compression, or trauma. CT or MR angiography evaluates blood vessels for blockages or abnormalities. Electromyography measures electrical activity of muscles and nerves to identify nerve or muscle damage. Lumbar puncture or spinal tap analyzes lumbar puncture or spinal tap analyzes cerebrospinal fluid for infection, inflammation, or bleeding around brain and spinal cord. Blood test check for infection, inflammation, metabolic issue, or autoimmune diseases. These tests collectively help to pinpoint the cause of paralysis and guide treatment approaches. Thank you for watching. Don't forget to like, share, and subscribe.